All right, welcome everyone to the State of Innovation Challenge Industry Engagement with Dr. Robin Henderson. I'm Julia Reed from the Challenge team, and we're super excited to have you here to talk to this amazing guest and dive into her cool background and the work that she is doing, especially on behavioral health for young people, which is one of the big focuses of the State of Innovation Challenge. So welcome, Robin. We're super excited to have you.
Well, thank you for having me. I'm super excited to be here.
So why don't we just start by talking a little bit about you? What is your title and where do you work?
Well, I am a psychologist by training. So I have a license in psychologist, a doctorate. And then I am the chief executive of behavioral health at Providence Health and Services in Oregon. So everything that happens in the mental health world, substance use, anything like that happens for Providence here in Oregon, reports eventually up through me. I'm also the chief clinical officer of Work2BeWell, which is our youth mental health engagement arm.
Awesome. Yeah, we're going to talk all about Work2BeWell in a second, but I just want to check. So I think you're from Oregon as well, right?
I am. I'm an Oregonian. I did spend 5 years working in Washington. I actually lived in a little town called Lacey
Nice.
shortly after college, and it was a great experience. Loved my time in Washington, but I'm a native Oregonian.
I hear you. I'm a native Washingtonian. I know those polls are strong. And I just want to say, I know we've got some folks watching live. If you have questions, go ahead and throw them in the chat at any point for Dr. Henderson, and I'll be sure to share those with you. So let's talk a little bit about you mentioned Work2BeWell and that project that Providence has. Can you tell our viewers a little bit about what Work2BeWell is?
So Work2BeWell is really a youth mental health engagement strategy that was designed by youth for youth. We recognized a few years ago that the best way that we could reach young people to talk about mental health issues was to have them talk to each other. So if we gave them resources and tools and platforms and all those other types of good things, they'd actually do it. They want to talk about it. If we gave them coursework and curriculum for their schools to use, it would actually happen because teachers and educators are starving for that kind of information. And for us, the biggest thing about Work2BeWell was that it always has to be grounded in youth voice. It always has to be driven by youth and where you see problems are. And everything has to be accessible, which means it has to be free. It has to be available. It has to be easy to get, all that other good stuff. So that's Work2BeWell.
That's awesome. And what are some of the problems that young people talk about through the system, or what are some of the common behavioral health issues that you see?
What we see and what we talk about a lot, there's the big ones of anxiety and depression, but we also talk a lot about trauma, whether that's trauma from child abuse, trauma from events that have happened. This pandemic is a trauma writ large. We've started to talk, especially over the last year, about intergenerational trauma and systemic racism, especially during the run up to the elections. We had a lot of conversations on our platform, Talk2BeWell. We have a podcast that I do with our student leaders called Talk2BeWell on Facebook every other week, and we take on current event issues, things that really matter. And we've talked a lot about the impact of the Black Lives Matter movement and where that fits for them. How you talk. One of my favorite episodes, how do you survive Thanksgiving and the Thanksgiving dinner table with people who have very differing political opinions in this highly charged environment? That always happens every fall. We always do that show on Talk2BeWell. But we also have been talking a lot about things like stress, sleep, coping mechanisms for dealing with social isolation, surviving Zoom school. And how do we make and keep those connections with each other and take care of ourselves at the same time?
Yeah, I think we're seeing the really unprecedented challenges right now, the new things that students are being called, young people are being called to deal with that they haven't had to, that hasn't been as much of an issue before. I mean, I think about my own teenage years, about a lot of challenges around behavioral health related to things happening in school. And now you have students out of school and really struggling with that isolation. Do you see that a lot?
We do. And how do they get recognized? It's much easier when you've got a student in a classroom to see that they're struggling. And it's hard enough to deal with that when you're in a classroom and you have them right in front of you. Well, now you've got them on Zoom. So how do you know when they're disconnected? How do you know when they're struggling? How do you know when they're going to need help when they're not having that type of social interaction?
What are some ways that you're seeing either young people reaching out to their peers or teachers reaching out to students to try to help them with that social isolation right now?
I've seen some really interesting ways of coping with this. We work with some athletic trainers who've been wanting to learn more about the mental health curriculum, and we're actually going to do some trainings with them because athletic trainers are starting to be the ones who can reach out and maybe go to somebody's house and connect with them in a socially distanced way and have some interaction to perhaps look at conditioning and things like that. I know several teachers who have figured out ways to visit their students' homes and have a socially distanced conversation. I've seen teachers also. I have a friend who's a teacher who's got a big, huge backyard. And last fall, when it was still pretty out, she had a socially distanced group of students come over and have a conversation about where we were going with Work to Be Well. Those things are meaningful. Those things really matter. For younger students, it's really popular to have a pod where you have 3 or 4 students together, perhaps with a tutor who are doing their Zoom classes together. That can be a really positive way to engage social interaction. All these things, though, take intentionality and effort. It used to be when you showed up at school, you bumped into people in the hallway. That's how you get involved in stuff. That's how you get invited to social things. Now we've lost our bumpability and
Hmm.
we have to figure out how we intentionally create that.
Yeah, I often talk to people about how we miss those kind of casual interactions and casual conversations. Even when you make a Zoom meeting with someone, you have to schedule it, and for
Mhm.
me as an adult doing work on Zoom, there has to be a topic and a purpose. You can't just
Yeah.
sort of catch up, and you miss those connections a lot. And it takes a toll on you too.
It really does. And I found myself this last week, a friend of mine and I, a work friend, we decided we were going to have a coffee date. And so we had no agenda. This was just like if we bumped into each other in the cafeteria and ended up having coffee together. And it was so refreshing. We got so much done with no agenda. We got so much done. And it's something that I want to do more of. One of the ways that I know for me, I've got a team of people that I work with, my directors who manage most of the world of Providence behavioral health. And early on in the pandemic, we started a meeting where we had regular meetings, early on in the very early days that were almost every day, but we've maintained meetings a couple of times a week that really we have an opportunity without an agenda to check in on what the current events are, to check in on what do you need right now, things we never would have done before. But now in the pandemic, we're intentionally scheduling time that's unstructured to say, okay, what do you got? And how can we get together and problem solve this together?
Yeah, and that's so important for managing. I know as a psychologist, someone who leads behavioral health, you're probably thinking a lot about how you manage that for your patients, but as an employer and a team member, you have to also think about how you manage that for your own team. Yeah.
Oh, yeah, definitely. It used to be in the Providence infrastructure, we have here in Oregon, I have 107 psychiatric beds in 4 different hospitals. I've got huge partial hospital programs with probably about 140, 150 people in those, an eating disorders program, a whole pile of other programs, and primary care. We're basically the largest provider of mental health services in Oregon.
Wow.
So I have a lot of managers, somewhere probably in the realm of 36 to 40 managers who manage all those different lines of business. And it used to be that it would be maybe once a year when we could all get in a room. Because here were the rules. You had to all be together, you needed to have an agenda, and you needed to take enough time.
Hmm.
And when COVID hit and we couldn't do that anymore, we realized we needed to figure out a way to communicate quickly with this group of people about something that we were dealing with in real time. So we set up twice a week manager meetings where we would get together at 1 o'clock and and have a little bit of an agenda, a little bit of a check-in agenda. But we realized really, being almost a year out of this, this will stay. And I'm sure we're going to have our big long, 3-hour meeting in a room where we can all get together and be so grateful about it. But we're also going to have those meetings that are every week where we're checking in and seeing how even just these people getting to know each other on a weekly basis and hearing from each other and understanding each other's services has fundamentally changed everything we do. Would
Wow.
not have done that a year ago. Wouldn't have even thought of it.
Yeah, a lot is changing now about how we interact, how we work, how we go to school. And some of that, one of the themes of the State of Innovation Challenge is that some of those things will go back to the way they were and some of them won't. And, we have to think about, what do we want to carry with us going forward. And just thinking about that and circling back on what we talked about a little earlier on how ways that young people are finding to connect in this pandemic. So next week, we're going to have an industry presentation from the Minecraft team at Microsoft, and they make Minecraft the video game. How are you seeing young people use online tools like TikTok or video games? Has that become more of a part of their behavioral health management, either for good or for bad?
I think it kind of has come and gone in waves. Early on, this was the primary way that people interacted. You saw the incredible explosion of TikTok and the TikTok challenges, and some of those have been very positive. Some have been not quite so positive, but I think they're moving in good directions. Um, I think we saw a lot of online forums, especially in Snapchat, where people could get together and they could talk and things like that. A lot of team chats. This is how a lot of sports teams and choirs and other groups have kept together. They have a team chat or a dorm chat or whatever it is that you've got. But I've also seen that waning. I did a talk to be well earlier this week with two students, one from Montana, one from Oregon, who the topic was sleep disorders. And they both talked about how early on in the pandemic, their main connection with people and their main thing of doing things was through social media. But they both talked about how they found themselves at some point just literally doing the scroll thing, where you're just scrolling through and scrolling through. And both of them independently started reading and really found solace in books. And now, one young woman was talking about how she reads 2 books a week, and
Mhm.
that's really eaten into her social media time. So it's opened up some different areas for people. But I think social media also has been an outlet to allow us to stay connected and reduce that social isolation, to talk about how we're feeling, how we're doing, and be honest about it. It's a vulnerable thing to do.
Yeah. Yeah, and that vulnerability piece, that's such an important part of, I think, of behavioral health skills. Is that something that you really try to work with young people on when you're talking about their behavioral health needs?
Absolutely. We have on the Work2BeWell website a couple of different pieces of curriculum that talk about how to have a crucial conversation with someone, how to really have an honest conversation when you're having to say something that's difficult. And then we have another set of curriculum around what we call ECPR, which is how you basically do emotional CPR. How do you help somebody who is really struggling
Mm,
get connected to some type of crisis service, some type of intervention to help them get help? And those types, teaching people how to have conversations is really one of the core elements of Work to Be Well. It's one thing to reach people who are in trouble and struggling and say, here's how you get help. But for many people who are struggling and really at that point, that breaking point, they don't often have the energy to be able to do it alone. They don't have the confidence. They don't feel that their problems are worthy of a conversation with someone else. And it takes someone coming alongside them and saying, you know what? Let's call the suicide hotline together. Let's call the counselor together. Let's talk to your mom together. And you're not alone. And if we can get that message of you are not alone out there to enough teens and enough youth, I think we're really going to be able to make a difference in what is this ongoing mental health pandemic.
yeah, that's so true. I think, and that is it's a really great insight. I want to transition just a little bit because part of our goal with these sessions is to talk about career pathways and industry pathways for young people who are interested in doing this kind of work, who might be listening and thinking like, gosh, I want to do that. I want to help people, who are struggling, who are in a mental health crisis, or I'm just interested in how the brain works and how emotions work. So how did you get into this field? Was psychology something you were always really passionate about? Was it something you came to later? How did you get on this path?
Well, when I was in high school, my career path, I was a musician. I was a classically trained pianist, and I had a scholarship to go to Willamette University to study classical music, and I was going to be a musician for all of that meant, which is a very interesting pathway. And it was probably somewhere around my sophomore junior year that I began to feel like this is great, but I don't think it's the totality of who I am.
Mm.
Um, and I took a course in psychology and actually had an opportunity to do an internship at a local alcohol and drug treatment facility for adolescents who were in the juvenile justice system, and found myself really drawn to and connecting with these young people who had significant mental health and trauma histories and significant issues with alcohol and other drugs, and found myself drawn to wanting to understand how they got there, but more importantly, how do you help them figure out where they go next? And how do you help them understand and know that inherently they have value? And even though they've got all of these struggles and all of these things that have not worked out so well for them, that there is a path out, there is a way out, there is hope, and how you instill hope in people really is the key to how you reduce youth suicide, because we know hope is a gigantic protective factor. And when people lose hope, that makes them hugely at risk for suicide. And it was through that experience that I really got inspired to continue working with, especially with young people in mental health settings. I went from when I graduated college, I went to Lacey, Washington, and worked at a brand new alcohol and drug treatment facility that I was on their startup team. And as a young person fresh out of college, to be on the design team where you're watching them build the facility while you're building the curriculum and you're building the treatment program was very, very inspiring. And it was a wonderful 5 years of my life. But when I was done in Lacey and I was headed back to Oregon, I was really at a crossroads, and I had to decide. All I had was a bachelor's degree. And if you're going to play in the world of mental health, there's really two ways you can go. You can go down the road and get a business degree and learn how to be an administrator, or you can go down the road and get a clinical degree and learn how to help people and be a clinician. And I really felt called to be a clinician. And that's when I went back to school in 1991, went back to school and got my doctorate from George Fox University in psychology. And all along the way, I maintained a connection the entire time I was getting my doctorate to working with patients, to working with people, especially young people, and trying to really further hone my skills and think differently about how we provide mental health care.
That's awesome. Oh, keep going, please.
I was going to say, no.
No, we're not there. Yeah, keep going.
Yeah, we're not there yet. But these days, when you look at my career path from there, when I finished and got my doctorate, I was in private practice. And I really realized that, yeah, I can do private practice. This is great. I can do, sit in an office with somebody and do therapy. And it's really, really wonderful. And it's very fulfilling. But I also felt that as a mental health system, there were broader and bigger issues to tackle.
Yep.
And could I take my clinical knowledge and begin to apply that in an administrative way to begin to really change how systems function and do what I call facilitate the practice of others? And that's what got me into working in administration and to really looking at, instead of just what is my interaction with you as my patient, what is my interaction with, the team of people who are caring for 30 to 40 patients, and how do I take care of them and set the conditions so that they can take care of the people that we serve in a different way. That's where I really felt connected and resonated. And I've always kept a hand clinically. I don't do that as much anymore, but I can jump into a treatment team with the best of them. and still operate in a consultative fashion, but really felt that my skills and abilities were more in how I look at the system as a whole and how we can change the system to be more patient facing, to be more trauma informed, to be a better system to serve the needs of people with mental illness who are so often relegated to the streets.
Mhm. Yeah, absolutely. And I think that's often, I want to unpack a little bit that word, that term you just used, trauma informed, because I think so often you can see, people saying like, oh, well, that person is, they're on drugs, they're homeless, they are, they've committed crimes. Like it's just because they are, they're a bad person or they make bad choices. But can you talk a little bit about what trauma informed means and how that's kind of changing the way we view how people maybe act in some of these high stress situations?
Yes, and I so appreciate the question because I think this is the future of where we're going, not only in mental health care, but in healthcare as a whole, and also in education. Um, People are the product of their experiences, and they bring, when they show up in a room, it's not just the interaction you and I are having, it's your entire background and history and my entire background and history. And if I acknowledge the fact that you and I have had very different experiences and I don't know your experiences, and always assume good intent, um, even when somebody is out of control, uh, that's the beginning of understanding trauma informed care. It's not what happens, it's not necessarily, how you're showing up in a room. It's like, what happened to you, what matters to you, what got you to the point where you're in my ER and you're so psychotic and scared and violent that you're lashing out at my nurse. What got you there?
Mm,
Because there's a great video that the National Alliance on Mental Illness put out that I think sums this up so well, where you see the typical situation where you have a combative, psychotic individual who may be drug affected, who comes into the room and is striking out at people. And you see the nurse trying to take his shoes, and he's like scared and slapping at people. And eventually, the whole situation escalates and they end up restraining him to the bed.
mhm,
What NAMI did was then flip the script and played the same scene back, but you heard it from the perspective of the young man. And you heard him talk about um, how scared he was and that he was afraid that people were after him. And you would watch then the interaction of people reaching in and grabbing him. And he's like, I'm afraid that you're after me because you are. I'm afraid that you're going to hurt me because you are.
mm,
And it was, nobody took the time to just stop and move everybody from the room and sit down and say, what happened? What matters? You know, how can in this moment we de-escalate this situation differently? Early in my career, I had an opportunity. Well, I guess it wasn't early, about midway through my career in 2000, I had this very unique opportunity. I had been in Portland working in psychiatric units. I was running several psychiatric units in two hospitals. And it was Portland, Oregon in the late 90s, early 2000. Um, the mental health system was a mess. And I had this opportunity to take my family and move to Bend, Oregon, and start a 15-bed, tiny psychiatric facility from the ground up. And we took 2 years talking with community members and people and thinking about it. And I said, I want to do things differently. I want a facility that has all private rooms, because at that time it was very common. You stayed either in a 2-person room or a 4-person room. So here you are at the worst place in your life, and you're going to have a roommate
yeah.
who you've never met, who's also at the worst place in their life, right? Um, so most people did not do private rooms. I wanted every room to have a view of nature because I think that's really, really important. And I wanted the facility at its core uh, to be human, to be trauma informed. We weren't using that language then, but to be seclusion and restraint free. So when somebody did act out, our first inclination wasn't to put hands on and control them, but to do something different. So the way we set this facility up was what we knew, and this is going into the basics of a psychiatric unit. The highest risk time for acting out in a psychiatric unit is meal times, because in meal times you've got everybody who's sitting there with their plate, and their food, and staff don't eat with patients, and it's a high risk time, and it's chaotic, and people have things that they can throw, and so some facilities make people eat in their rooms alone, and other facilities do all these other kinds of things. I'm like, we're gonna start with changing mealtime. Everybody eats together. We eat family style, and staff eat with patients.
Hmm.
And we're going to sit down together, and we're going to share a meal. And this isn't I'm going to look at you and say, you need to finish your green beans. Because let me tell you, the number of people who've been put into seclusion and restraint over green beans, let's not talk about that. But the idea that for this period in time, I'm going to engage with you in our shared humanity, and we're going to break bread together and share a meal. That changed everything. Have a room where we had a big, great room, and a place where people could gather that was always open and always available. It wasn't like I had to unlock the doors so that you could go into the TV room. You could walk out of your room and go into the TV room, because that's where it was. And an open nurses station where, you saw staff and you knew what was going on, and things were very, very open. But part of the key that made this work was people are going to get escalated in these situations. People get scared, something happens, something triggers them, something triggers their trauma. Many times you don't know what that is, and somebody starts to act out. And what we found was, if we could either remove them from the situation or remove everybody else from the situation, that gave somebody a better ability to calm down. So the way we built this facility was, we had an outside area that the door was right off the great room. You could unlock that outside area, and everybody could go outside and leave somebody inside, or that person could go outside, and there was a whole big gated in area. And we set that up intentionally so that you didn't have to lose your self-control in an environment where people felt they need to put hands on to keep you safe. There's a lot more behind that, but it really goes into this whole entire approach of understanding that we all have had trauma that we don't understand, and we need to acknowledge that trauma and start from there, rather than presume that all behavior is pathological.
Yeah. No, I think that's
that was a long answer.
No, I love that. And I love what was great about that answer is it's such a good example of design thinking, and how, which is what we're hoping to encourage young people to do through the challenge, is just as you did, like, put yourself in the shoes of the person you're trying to help, and what do they need, and really start from there and kind of build outwards. And I think so often, whether it's in healthcare or education, I'm sure students probably feel this way, that like things are built around them and they are expected to conform, instead of thinking about what they need and building out from there. So much of our world is not designed from the human, from the user, as to use a tech phrase, in mind. So I think it's beautiful to hear how you kind of employ that in your work. I think that's awesome. Do you have any advice for young people who maybe want to get into this career, who want to work in mental health care, or maybe want to become psychologists? What are your words of wisdom for them?
Go try it out. There are all kinds of opportunities working in the mental health field, even pre-bachelor's degree, but definitely between your bachelor's and master's degree. Go try it out. Get some experience in the field. The best things I ever did were working in the residential facilities, where I've worked every shift: night shift, day shift, swing shift. I've done groups, individual therapy, family therapy, continuing care, admissions, you name it. Every role you could possibly have in a facility at some point or another, I've done. But understand where people are at, and having that experience of working with seriously mentally ill individuals really will tell you whether or not this is where you want to go. The idea, and I use this, and sometimes it comes off as a pejorative, but I talk a lot about the worried well. and 50 minutes in a fern, and the idea that, you know, we're all Woody Allen, although it's probably lost on most students
Yeah,
in terms of Woody Allen. but
unknown reference.
but where you go and you sit in your psychologist's office on the couch, you
Mhm.
spend 50 minutes, and it's a nice, pretty thing. Um, that is a part of mental health, and that is a part of what people need to do. But having that breadth of understanding of what somebody looks like in a mental health crisis helps you understand really the importance of the work. Having a grounding in understanding what mental illness looks like if you're not able to intervene sooner. And this is
Mhm.
part of why I got passionate about Work2BeWell. I worked with seriously mentally ill children when I worked at the state hospital. And seeing the places where we could have shifted things earlier on, we could have intervened better. You know, the thought that right now we know that 75% of mental illnesses are start between the ages of like 10 and 10 and 24. 75%. And yet what do we do societally to screen for that? When we know that, you know, your average 16-year-old who presents in their pediatrician's office with a mental illness, it can be up to 10 years before they see and have their first actual intervention.
Mhm.
And that's the average of what we're looking at for when people get services for help. We see that somebody, you know, I've heard that, oh, they'll grow out of it. It'll be fine. They'll grow out of it. No, they won't. They're
Mhm.
just going to adapt and develop more dysfunctional coping skills at a point where, had we intervened sooner and taught people coping skills, perhaps their life trajectory would be different. Perhaps things would change. But if we know that 75%, if we know 20% of everybody is going to get a mental illness at some point in their lifetime, and 75% of those illnesses start before the age of 24,
Mhm.
think about it for a minute. If this was breast cancer, and we knew that 75% of people with breast cancer would be identified between the age of 10 to 24, where would we be doing mammograms?
In the pediatrician's office.
Yes, exactly. And that's the thing. We've got to figure out, and it is this generation that's going to demand that we screen for these things as part of what we do, because they don't want to go their entire life when we
Mhm.
could have changed that trajectory when they were 12.
Yeah. No, absolutely. I think that's so true. And do you like, I think it's such a reflection, as you said, about how we as a society have treated illness, what we think of as illnesses of the body, as opposed to mental illnesses. Though we know, of course, that like mental illnesses can also affect your body and can affect your
Yep.
physical health. You talked about trauma, and I've often heard the phrase, you know, the mind forgets, but the body remembers, and you carry that along. But I'm interested. You mentioned that this generation will demand. So, are you seeing kind of a different attitude? I know you work with teenagers through Work2BeWell. Do you see kind of a different attitude, a different level of expectation from young people around having their mental health needs really respected and cared for?
Very much so. I remember I have two children, and they're both in college now. But I remember when my oldest was in high school, and one of his friends, who was a soccer player, came over and he said, "Yeah, I've got seasonal affective disorder, and this is what I need to do for it, and this is how I take care of myself." And I'm like, "Wow, okay." You know, it was just like he was telling me about, yeah, I got a knee strain, you know?
Mhm.
Oh, okay. They're much more open about it. I have students who talk all the time on Talk to Be Well about their anxiety and the coping mechanisms that they use, and the coping mechanisms they got from their therapist, from using the Calm app, from using Headspace, from, you know, whatever place it is. I talk to students all the time who struggle with depression, and they talk about how they make that work, and what they do and how they intentionally exercise, diet, what are the triggers that they look for. I talk to students with social anxiety who talk about how difficult it is just to show up someday. And that was part of the basis of the bill that we ran in Oregon 2 years ago in the Oregon legislature that got students the ability to take a mental health day. You would think that you wouldn't have to fight with your school to take a mental health day. I'm depressed. But the attitude in Oregon, at least, was, well, if you're depressed, you should show up at school. You shouldn't be alone. It's like, wait a minute. I'm so anxious, I can't even get out of bed. Forcing me to get out of bed today, probably not a move.
Yeah.
And just feeds that anxiety. And that bill, passage of that bill was so freeing for so many youth. They demanded change and they got it.
That's awesome. Well, I want to ask you a couple questions about specific to the challenge in a second, but just a shout out, because I know we have a few live viewers. If you have questions for Dr. Henderson that you'd like me to ask, feel free to put them in the chat, and I'm happy to push those over to her, and we can go in. But such a rich conversation. I'm really enjoying this. So I hope our viewers are too. So I want to talk a little bit about the challenge case. So one of the cases that we've offered to students that they can work on in this challenge is the kind of responding to COVID-19 case. And part of that is asking them to think about, how could we better support the mental health of teens or elders? They can choose, they could talk about both, while they're going through this pandemic. And you used a term earlier, the mental health pandemic that we're experiencing simultaneous with the viral pandemic, the COVID pandemic. And we've really kind of opened this up to students. We've said, your solution could be something technological, or it could be something really analog. It could be, going for a walk with people, or the emotional CPR that you mentioned. Do you have any advice for students who are working on the responding to COVID case, who are trying to think about, okay, how could I better support mental health for people in my own age group during this time? What would you encourage them to think about as they're approaching this problem?
I would encourage them to think about where teens show up. Where do you show up? And if, their most common place to show up right now is the Zoom classroom, how does your answer engage them where they are? One of the biggest problems in the care for mental health, folks with mental health, is that we often make it very difficult to get care. You show up somewhere, it's like, oh yeah, we don't do that here. You need to call and make an appointment with XYZ. Oh yeah, no. You need to go over there. And we really have taken a philosophy at Providence that, and this was something that when I came here 5 years ago, I said really, very clearly, we know that we're successful when there's no wrong door for care. We know that we're successful when you show up in the right place, and I know how to help you, even though I may not be the end user who helps you. I know how to help you, and I'm not going to look at you and say, here, you need to go on the Psychology Today website and Google a therapist. That's not a move. We're not going to do that anymore. So think about where teens are and how does your intervention meet them where they are, as opposed to sending them somewhere else, even if that's a web page.
That's awesome. Yeah, I love that idea of meeting people where they are. That's a really common issue that we confront, even in designing this program. Is how can we meet people where they are? Well, this has been such a rich conversation. I really appreciate your time, Dr. Henderson. Thank you so much for joining us. I want to remind everyone that Dr. Henderson mentioned a couple times Work2BeWell, which is Providence's behavioral health resource that's by teens for teens, and that is linked on the innovation.org website under industry resources. So if you want to explore that some more, if you have questions, I'm sure we can send those along, and maybe Dr. Henderson will help us, or her team can help us get some answers. But I just want to thank you so much for your time and for this super rich discussion, and hope we'll get a lot of great projects back and good ideas we can share back with you.
I am excited to see what people come up with, because, you're looking at this from a perspective that I don't have. And I can't wait to see what innovations you bring to the table, what your students are thinking about. And I hope I get to see this all as it comes forward.
Awesome. Love it. All right. Well, thank you so much, Dr. Henderson. Have a great day. Thanks everybody who's able to join us, and we'll talk more soon. Join us on next Tuesday this coming Tuesday for our session with Microsoft Minecraft, our next industry engagement. Thanks so much, Dr. Henderson.
Thank you. Bye.